Hi, I'm Gail Macklin, registered nurse, international board certified lactation consultant here at New Mother, New Baby, a lactation center located in Northbrook, Illinois. Today, I want to talk about what to do if you get home from the hospital and you have this little baby and you're wondering if your baby's getting enough at the breast. And this is one of the most common questions that moms and dads come in with to see us. And this is what I would tell you as far as a few things to look for to help you to know whether your baby's getting enough. And this is it if you're exclusively breastfeeding. You're home from the hospital and you're nursing at every feeding. The baby's latching on okay, but you're not sure if the baby's getting milk. So remember, the first few days, there is not that much milk. The baby takes a small amount of milk at every feeding. So what we're looking for in days probably 0 to 4 is you want to see one wet diaper and one poopy diaper in the first 24 hours. You want to see 2 wet diapers and 2 poopy diapers in the second 24 hours. You want to see 3 wet diapers and 3 poopy diapers in the third 24 hours. And you want to see 4 wet diapers and 3 or 4 poopy diapers in all the days following that until they get to about 4 weeks, 4 to 6 weeks, where poops tend to decrease for some babies, not for all babies. So we're looking for, if it's going in, it's got to be coming out. So you're looking for wet and poopy diapers. The other thing you're looking for is, do my breasts feel more full before a feeding and softer after a feeding? And this is another way to tell. But the first 4 or 5 days, your breast may still be on the softer side, and that isn't a great way to tell. But after about day 4, for many women, they get like a very full or engorged feeling. And then when their baby's done nursing, sometimes their breasts soften up. So that's another way to keep in mind that can be helpful. The other way is when babies are really hungry, they tend to have tight fists. They tend to be a little more like agitated, and especially around 3 or 4 days, they start rooting and they're looking for the breast kind of with their mouth and their face, and they kind of go like that. They're kind of rooting, we call that. That's the rooting reflex. It's a reflex. And then once they start nursing, they tend to get a little bit more relaxed and they kind of fall asleep at the breast. And almost all babies early on will fall asleep at the breast. So then you're left wondering, did my baby get enough to eat? So what you're going to do is you're going to make sure you're tracking wet and poopy diapers, because remember, if you're exclusively breastfeeding, that is a good way to know. You're going to see if you start feeling a little more full around days like 3, 4, and 5, and if it feels softer after a feeding. That's another good way to know. You're going to look and see if your baby seems more relaxed towards the end of the feeding, and that's another good way to know. Now, some babies will want to nurse an hour after they're done feeding, and that is perfectly normal. Some babies will want to nurse soon after, and you're just going to keep counting wet and poopy diapers, look for fullness before and more soft breasts afterwards. If you're not sure if your baby's getting enough, the number one important thing to do is let one of your healthcare professionals know. So you can always call your pediatrician and go in for a weight check. I always tell people when I see them prenatally to make sure they schedule their outpatient lactation visit for the day or 2 after they get home from the hospital. The day you get home from the hospital is a hectic day, but a day or 2 after is a good way to get a baseline. You connect with your lactation consultant. You kind of get a feel of if your baby's gaining weight, because if your baby's not gaining weight, then we're probably going to have you do some pumping because we don't want you to lose your supply. So these are a few ways to know that your baby's getting enough. And when you come in to see a lactation consultant, we actually do a pre and post weight with a very sophisticated scale. We weigh the baby, then you feed the baby, then we re-weigh the baby, and we can see exactly what the baby's getting, which will make you feel much more reassured that your baby's getting enough at the breast. If you feel like your baby's not getting enough at the breast, it's okay to break out your breast pump and pump a little bit. You can always give whatever you pump to your baby. And if you're not getting anything and you're still feeling like your baby's not getting enough, You can go and see if there's donor milk you can purchase somewhere if you don't want to use formula, or give a little bit of formula until you see your healthcare provider. Hope this helps, and we'll see you in the next video.